Okay, yeah. So I'm Ben Showalter. I'm a third year resident at Full Circle Health program. I'm honored to speak to you all today about a topic I'm passionate about, which is climate change and its effects on health. It's a big topic, and so I want to kind of hone more on the lung disease side of things, but definitely leads to more questions as I walk through the presentation. But again, yeah, I have no disclosures, and I will disclose that I'm not an expert in this area. It's just something that I'm passionate about and have grown an interest in throughout my training at Full Circle Health. So here's just the accreditation and disclosures slide. So our objectives, kind of in broad brushstrokes, are to understand global warming patterns and their overall effect on health, to stratify the health sector contributions to climate change, and then discuss particulate matter and its effect on respiratory disease. And then we're going to highlight the forest fires in the Northwest US, as that kind of hits close to home for a lot of us, and their effect on respiratory disease. And then to end off, we'll do kind of an overview of management plans and interventions for both the mitigation of air pollution and treatment of respiratory disease that largely comes from climate changes. So to get things rolling, just talking about kind of origins behind this term of climate change. So human activities, largely through the emissions of greenhouse gases, have unequivocally caused global warming, or contributed largely to global warming. We know this through statistics and findings that we've gathered over the last century plus years or so. So global surface temperatures in 2011 to 2020 are about 1.1 degrees Celsius above those recorded in 1850 to 1900. And 1850, we use that number because that's when we started to record global temperatures, was in kind of the mid 1800s. And there's ongoing emission contributions arising from unsustainable energy use, land use, lifestyles, and patterns of consumption and production across regions. And this human-caused climate change is already affecting many weather and climate extremes in every region across the globe, as we're seeing with summertime wildfires today. So many of these weather extremes, such as wildfires, are contributing to further climate change themselves, which kind of perpetuate this difficult cycle to break. And as I'll allude to throughout the presentation, vulnerable communities who have historically contributed the least to climate change are disproportionately affected by its impacts. And this is evident both on a global scale and on a national scale. And currently, as we sit now, there are gaps between the projected emissions from implemented policies that we have in place right now, and those from something called nationally determined contributions. And these NDCs are kind of a climate action plan to cut emissions and adapt to climate impacts. And they can get a little nitty gritty, so I won't go into detail with them here, but there are finances available for sustainability measures, but they're falling short on the levels needed to meet climate goals that we need to better our air quality and better our health from that. And then if we can go to the next slide.
Yes.
So before kind of going through more of these slides, I kind of wanted to pause and take a second to acknowledge kind of the stress and anxiety of this topic, because it provokes those feelings a lot in many of us, myself included. So I wanted to mention the concept of climate anxiety, which essentially stems from this vicious cycle of the knowledge of the climate crisis and mental health complications that kind of perpetuate each other, with those two kind of feeding, like anxious about the climate, and then the worsening climate change causes more anxiety, and so to speak. And then Layla, if you can just filter through, there's, different words for climate anxiety too, which, you'll hear solastalgia, climate doom, eco grief, and then one more is just eco anxiety. They all kind of are meaning the same thing. But in an effort to kind of give us a better characterization of this idea of climate anxiety and how it manifests in our communities, I wanted to just bring this up now and just highlight a few examples of how we see this and what we can do about it. And so we have found through research and time that when it's hot summers with extreme heat, that there's increased rates of violence, aggression, and self-harm. So in the summer months, we see more of that. And then also, there's surveys done, and many youth are showed to be frightened of the future in regard to climate change and what their communities might look like, say, 20 or 30 years down the road, and that worsens climate anxiety as well. And then many of us may have heard of this topic of doom scrolling, and it's in regard to social media, and it's ever present in our communities, where we can see these horrifying stats and statistics and pictures about climate change, and that can worsen these symptoms as well. And then to end kind of on a more positive note, not letting us feel too far down, we can mitigate this anxiety with something called internal activism, which is allowing these climate emotions to kind of be normal and move through us and acknowledge these feelings is a good sign that we actually care about the future of environment and want to make a change. And on that same note, it's important to work on what's called climate resilience as well, by supporting mental health systems and making the diagnosis more recognizable in our kind of clinics and hospital systems. Um, Next slide. And then kind of going off this is just a study that I found from Yale. It was published pretty recently in July of 2023, I think, um, or maybe late 2022. I can't remember. But it's data that was taken from Yale, and it's from a survey that was sent out in kind of a survey called Climate Change in the American Mind. And it uses GAD2 climate, which is pretty interesting. It's very similar to GAD2 that many of us working in healthcare are familiar with, but it's listed here on the slide. But it looks very similar to GAD2, but it asks questions like feeling nervous, anxious, or on edge because of global warming, or not being able to stop or control worrying about global warming. So it just adds that little extra flair to the GAD2 question. But what they did is they asked survey uh, patients through a survey these questions, and it showed some interesting findings that I thought were worth mentioning, worth showing, and you can see them here. But the interesting things that I saw is that the most impacted populations from climate anxiety seem to be the Hispanic Latino population, and they didn't talk about this in the paper, but my thought is because they tend to be a more vulnerable patient minority living in more urban deserts and not having as much tree canopy and things like that. So they see the effects of climate change more and so are more worried about it. And then it's also interesting to note that the least impacted is the baby boomer population, which is thought to be because of the older age and not being as future oriented, so to speak, and kind of thought patterns and worries as, say, like the Gen Z and Gen X populations, as you can see in this, are a little bit more worried than other populations. So I just wanted to throw that out there that climate anxiety is real. And if you have some while listening to this, it's a very normal feeling. Okay, next slide. Okay, so then getting into some of the weeds of climate change and health. This is data that was taken from the IPCC report, or the Intergovernmental Panel on Climate Change, from 2023, so pretty recently. And what it does for us, it kind of highlights the warmer temperatures in the last decade. If you can see that, it's, as I mentioned before, 1.1 degrees Celsius warmer than 100 years prior. And you can see that in that little kind of cartoon right by the 2020 vertical line. And then what this figure also does is depict a possibility of warming trends in the future, depending on how we address climate change here and now. So going to the right of that 2020 line, you can see 5 different scenarios of if emissions get a lot worse, which is the very top bar, or if we implement some more policies and emissions are lower, which is the bottom bar. And then another takeaway I want to get at too, and Layla, if you can just filter in the animation, um, is that we can see that like babies or toddlers born in the last couple of years are going to be more impacted by the effects of climate change. And we can see like a 70-year-old in 2090 is at much higher risk for the impacts of climate change as opposed to a 70-year-old living today, kind of thing, based on the models that this report gathered. Next slide. And then this is a little bit busy, but I'll try and orient us a little bit. But this is more data and figures from the IPCC report. But the graph on the left depicts kind of the same information that we were reviewing before, but just in a little bit different way. So it may just give us a more visual idea of how higher emission scenarios will lead to more kind of rapid increase in global surface temperature changes if we have lots of emissions versus low or very low emissions kind of thing. And then the figure on the right, I want to spend a little bit more time on. It's also kind of modeling future projections, but more in the context of projected adverse impacts from climate change. So you can kind of see those listed on the very bottom of the figure there. But to get us all oriented, the bars there's pairs of bars, and the bars on the left are from an AR5 report, and the bars on the right are from AR6. And AR stands for Assessment Report from IPCC, and the AR5 was published in 2014, and the AR6 was published more recently in 2022. Um, and then you can see, they may be hard to see on your screens depending on what you're looking at, but the small dots on the side are kind of confidence intervals, and they represent just the confidence, with one dot being low confidence and four dots being high confidence of these impacts happening based on temperature changes. And so overall, we can see that as we increase in global surface temperature change, the potentials for each adverse impact increases, some sooner than others, such as extreme weather events, which you can see has the impacts happening without as much temperature rise kind of thing. And then another big takeaway I want us to get from this figure is that the significant change we see looking at the AR5 report and the AR6 report, which is if you look at each pair of the reports or each of those column pairs, you can see that little dotted line, which is downsloping for all of them, which essentially means that these impacts of climate change are predicted to happen with less temperature increase, because we're already kind of seeing effects with weather event changes and things like that. So overall, this data shows that with further warming, climate change impacts will not only become more likely, but also probably more complex and difficult to manage if we let them get more out of control kind of thing. Next slide. Okay, so that was kind of like climate change in general, and to kind of ease more into its relationship with health and just human health in general. Uh, the impacts of climate change on health are already, we already see effects harming through air pollution, disease, extreme weather events, as I mentioned, forced displacement and food insecurity, and then pressures on mental health too, as I mentioned earlier. And then transportation in all forms also contributes to a very large portion of emissions, as many people likely know. And we, as clinicians and people working in healthcare, or just individuals, can combat these impacts with green alternatives, which not only benefit the individual health, but also planetary health. And then little things like walking, cycling, and stuff like that could serve as good alternatives too, if within reasonable distance to, work or grocery store or something like that. And then food also, something that is a huge carbon emitter. Food production and distribution is a huge part of this carbon footprint that often goes unnoticed by us. It's like more sustainable production would mitigate these climate impacts and support more nutritious diets that, roughly speaking, could help millions from premature deaths in a year kind of thing. And then the picture on the right, I just included, this is from the European Environment Agency, and it shows kind of just a good depiction of the impact and process of what goes into food production and distribution, which is huge. And there's so much carbon loss from just getting, an apple to our table kind of thing. And, you can kind of roll your eyes through this, but essentially it starts at the farming process, and there's tons of different kind of transport that goes into this. And then you have to get agricultural production involved, and then processing. All this food is usually packaged into plastic and stuff like that. And each of these steps has its own amount of like carbon waste along the way. So this flowchart just gives us a good kind of visual representation of how much goes into that. And then another key consideration is that healthy communities rely on well-functioning ecosystems to provide us with clean air, fresh water, medicines, and food security. And these help to limit disease and stabilize the climate. And then unfortunately, with climate change, biodiversity loss is happening at an unprecedented rate, which is impacting human health worldwide and increasing the risk of emerging infectious diseases. And then hopefully on a little bit more optimistic note, there's been some models done in kind of IPCC and whatnot about the dollar value of all the potential health gains that we could get from climate mitigation measures. And they're estimated to roughly double the cost of carbon mitigation measures themselves. So in number values, it's roughly comes out to about $8 billion per day of healthcare costs that can be attributed to climate change. So things we're treating because we think they're from the effects of climate change. So in other words, like this dollar value of healthcare savings that we would get from implementing carbon mitigation measures is kind of far exceeds the expense of implementing, or is far cheaper than the expense of implementing these policies. Great, next slide. So some of you may have seen this. It's taken from the CDC and is used quite frequently in talks of climate change and health. And so I just wanted to include this here as we transition more into the health effects of climate change. But it just provides us with a good overview of how all aspects of health are affected by climate change, right? Um, so we don't have time to obviously go into each of these nitty-gritty topics. We'll focus mostly on the air pollution. But just to get you guys oriented, this looking from the inside of the wheel out, the inner wheel is kind of the climate impacts that we see in our environment, rising temperatures, more extreme weather, and then those kind of branches of the climate impacts then affect areas of our health in different ways. And you can kind of see how each of those different aspects of climate impacts is impacting different areas of health. But as mentioned, we'll kind of linger in this green area and the air pollution with asthma and a little bit on like severe weather and heat as well. Next slide. Um, and then this is kind of just a broad overview of healthcare emissions in general and just some stats that I wanted to bring up before diving into lung disease. But the healthcare sector, and some of you may have seen these stats already, but the healthcare sector emits about 4.4% of global greenhouse gases. And then a crazy statistic is if the healthcare sector were a country itself, it would be the fifth largest emitter on the planet. Um, and then the US health sector specifically is the number one contributor of global healthcare emissions among all the countries in the world. And then the US healthcare sector emits about 8.5% of all of US greenhouse gases. And then just to give you an idea of where those emissions come from in our healthcare system, almost all of them, or I should say a large majority of them come from supply chain. So like scope 3 to emissions kind of thing, getting things to hospitals and clinics. And that's about 71% of our emissions. And then 17% actually come from the facilities and the vehicles operating them, and 12% from just maintaining those. So cooling, heating, electricity, and steam and things like that. Next slide. And then this is a little graphic that I included in here too to give us a visual idea of how significant the US carbon emission impact is compared to other nations. So this was pulled from Healthcare Without Harm. It's a report from 2019, and it measures tons of carbon dioxide equivalent emissions per capita. And then Layla, if you filter in the animation on this one, it's kind of hard to see, so I just highlighted with an arrow where US is, but you may have been able to guess based on just how high the carbon dioxide equivalent emissions are on there. But you can see from this that US is not only spending the most GDP on healthcare, but it's also emitting the most from that sector than any other nation by a pretty healthy margin. Okay, next slide. And then to get into lung disease, this is just a figure that I pulled that just gives a pretty good overview of how climate change is impacting our lungs. So it gives a broad picture of that interplay between direct climate-related hazards, as I talked about before, and the impact on lung morbidity and mortality. So, we have worsening weather events, and then this causes changes in allergen, increased heat, worsened air quality, and then increased infectious disease, all of which can take a toll on our lungs. And to kind of dive deeper into that, those various topics, if we could go to the next slide. This kind of gives us a little bit more detailed information, and I like this figure a lot because it breaks down all the different components of climate change and its effect on our lungs. This was taken from the European Lung Foundation, and it's a patient-led organization that works internationally to bring patients and the public together with healthcare professionals to improve lung health and advanced diagnosis. So pretty cool organization. And I just wanted to use their model to highlight how these different impacts of climate change can affect the lungs. And then Layla, I put a little fun sun animation in for all these. So as I move through like extreme heat flooding, if you could just click through, and then a little sun animation should pop up. So for extreme heat, so extreme heat can worsen underlying lung disease, as we may have figured, and it increases the frequency of exacerbations of things like COPD and asthma. And then also there's more drought with higher temperatures, right, which causes more dirt and debris in the air, making it harder to breathe. And in addition to this, wildfires are more common with higher heat as well, and that can worsen the air we breathe. And then moving on to flooding. Um, flooding, uh, mainly just the big thing with flooding is it increases mold growth kind of over time when stagnant water sits around too long, which can cause lung infection and worsen underlying lung disease if it's present in people with things like asthma and seasonal allergies and things like that. And then moving to infectious diseases, as we encounter a warmer climate, this allows for increased germs to spread and infect a little bit easier. And lots of expert models and kind of thoughts suspect that we will have greater risks of these kind of new infections leading to epidemics in the future if we continue to have rising temperatures. And then for the plant pollen, hotter temperatures also contribute to this, and more carbon dioxide in the air leads to more pollen production from plants, which can have a huge impact on allergies, which can, of course, exacerbate things like asthma and COPD and lung disease. And then finally, the air pollution. As kind of alluded to in the first few slides of this presentation, there's a pretty close interplay between air pollution and climate change, which probably seems pretty obvious, but air pollution, causes climate change, and then as climate change gets worse, the risk of air pollution increases. So it's just this horrible perpetuating cycle that's very difficult to get out of. Next slide. Uh, so let's see. So the throughout like climate change literature, you'll see mentions of something called ambient particulate matter pollution, or APMP for short. I'll call it APMP as we go through this talk because it's a little bit easier to say, but pollution for carbon emission largely comes in the form of this APMP, and these are small particles that are about 2.5 micrometers. So for reference, the nasal cavity and pharynx are about 5 to 10 micrometers. The respiratory tract is about 1 to 5 micrometers, and then the alveoli and bloodstream are about 0 to 1 micrometers at their very smallest. So if the particles are small enough, right, they can get into the alveoli and bloodstream, which not only worsens respiratory effects, but also causes cardiovascular effects and worsening pre-existing conditions. And so a lot of this comes from like industries with burning of coal, disposal of agriculture residue, and increasing vehicle and factory use contributing to increased APMP. And if you look on the picture on the right, this kind of gives you an idea of how small these particles are and how they can get into the alveoli and bloodstream. So that's, kind of a grain of sand and a piece of hair. And then those small red ones are just the little particles that are less than 2.5 micrometers. But reducing the amount of these small APMP particles in the air would likely prevent the amount getting into the lungs and bloodstream, which would in turn hopefully prevent worsening prevalence and symptoms from obstructive lung disease. Next slide. Okay, so this was a good study that I just wanted to highlight. It was taken from China and kind of highlights the APMP burden pretty well. But it was obtained from something called the Global Burden of Disease from 2019 and provides worldwide and comprehensive assessments of health loss for many diseases. And this study included 204 countries and stratified into 5 groups based on kind of socio-demographic factors kind of thing. But they performed regression analysis, which was used to analyze the attributable burdens of things like age, sex, year, location, all sorts of stuff, and therefore determine the impact of APMP on respiratory disease. But looking at this kind of data, it gives a pretty good depiction of the bimodal burden of respiratory disease, kind of in general, but how climate change impacts that as well. But if we look at these graphs, we can see that there's significant lower respiratory infections, kind of bronchiolitis and asthma in younger years, and then progression to more COPD type obstructive lung disease in later years. And then with also a component of some cancer contribution as well, if you see the kind of dark blue increasing. But interesting just kind of takeaways from this distribution chart is that for whatever reason, males tend to be more affected in death rates and something called DALYs, which is disease adjusted life years, which is alluded to a lot in this study. And then we can see as we get older, there's this pretty significant increase in death rate when we get up in age, especially when we hit that 80-year mark, which is pretty substantial for COPD. But kind of the key takeaway from this graph is that obstructive lung diseases are the main cause of medical burden from lung disease in general, in both younger years with asthma and bronchiolitis, and then in older years, largely in the form of COPD. Next slide. And this comes from the same study and highlights just a different part that I want to emphasize, but this is pretty similar graphics that they're using. So COPD is in green, the lower respiratory tract infections are in orange, like tracheal, bronchial cancers are in blue, and then upper respiratory tract infections are in pink. But this, to get us oriented, the lower row of each country listed is data from 1990, and the upper row is from 2019, so about a 30-year difference or so. And Layla, if you want to filter in the first animation. So these arrows kind of highlight some of the more wealthier nations that we may be familiar with, and they're showing improvement actually in the last couple of decades just because of the medical resources that they have. And then if you filter in the next animation, these are some of the more poor developing nations that show worsening outcomes over that time just because they don't have the resources to fight these effects from climate change and increased temperatures and stuff in regard to obstructive lung disease, but just gives us a pretty good example of that discrepancy. Next slide. And this kind of goes along a similar theme like that, but just gives us a more visual representation of the geographic disparities in morbidity and mortality from respiratory disease. And really just want to hone in on figure A, which represents COPD. And just to get us a little more oriented, the regions in dark red are greater than 240 DALY rate, and then the dark blue regions are doing the best, and they're less than 70 DALY rate. And we can see kind of the developed nations seem to be harder hit. It is interesting that China, which is the world's second largest economy, is still being hit pretty hard by COPD, and this is largely because they have such significant air pollution burden despite having the finances and economics to probably deal with it, which I found pretty interesting. Next slide. And then I think this is one more slide on kind of the vulnerable populations, but I think it's pretty important to mention. But this idea of social inequities is apparent in climate change and health, and it is well known that more vulnerable populations in underserved communities and nations are just affected more. Just to give us some examples, the African American populations in California experience about 40% higher prevalence rates of asthma. They have about 4 times higher ER visits for those reasons, and about twice the death rate from asthma, unfortunately. And then these vulnerable populations are just not able to mitigate the effects of climate change as well, right? And examples of this is that they cannot afford more climate-friendly diets. They can't afford investment in things like air conditioning, air purifiers, insulation, flood-proofing their homes. And they just have an inability to make movements in their communities to less impacted locations. And then additionally, the vulnerable populations often work in areas with increased exposure to air pollution, such as, proximity to polluting industries, maybe working in a place with a lack of green space, working in urban heat islands. And then some of this kind of stems from a history of redlining in larger communities, which is when financial services are sort of withheld from neighborhoods that have significant numbers of racial and ethnic minorities, to put it simply. But this really happened, 50 or 60 years ago, but we're still seeing its effects today with vulnerable groups living in these areas that just aren't able to cope as well with extreme heat, weather events, things like that. And then worse health effects from climate change makes these vulnerable populations even more disadvantaged, which kind of alludes to that really difficult cycle where these problems just kind of perpetuate on each other. Next slide. And then this is another study that I thought was pertinent, also coming from China in 2018, but I thought it was really good because it shows, it was published in the Lancet, and it kind of shows how these numbers, kind of depressing numbers, can be improved. But In sort of an effort to mitigate the levels of air pollution in China, the State Council of China issued something called the Air Pollution Prevention and Control Action Plan, and this was done in 2013. And what they did is they set SMART goals for a 5-year target for APMP reductions for regions of the country. And they did so using kind of Big 10 umbrella overarching tasks. Um, and I won't list all the tasks, but to highlight some of them, they focused on accelerating, technology transformation, increasing their clean energy supply, improving environmental economic policies, which is a big one, establishing monitoring systems to cope with air pollution episodes or extreme weather events, things like that. And so they did this analysis of national air quality monitoring mortality data to estimate the health impacts of this plan throughout the 5-year study. And what they found is pretty neat. So the amount of APMP decreased by about 33.3% over the course of the 5 years. I didn't unfortunately go into detail on how they measured this, but I'm sure they had some scientific way to measure those small particles. And then as a result of that decrease, there was a measured decrease of about 42.7 thousand fewer deaths over that time and 710,000 fewer years of life lost, which is pretty good. And then this provides us with kind of optimistic and reassuring data that policies and system changes can reduce climate change burden and the subsequent health impact we have from that. Next slide. Okay, and then so kind of shifting gears to somewhere a little bit closer to home for us. Um, so wildfires are a big topic with climate change, especially up in the Northwest. Um, and then the following information here that I'll talk about was pulled from largely from the USDA or the U.S. Department of Agriculture. But kind of overview of wildfires is that, as I mentioned before, average annual temperatures are rising, especially across Idaho, Oregon, and Washington, and have increased about 2 degrees Fahrenheit in this region since 1895. And there's lots of different projections, but a lot of them point to maybe like upwards of 5 to 6 degrees Fahrenheit by 2050 if we continue on this road. And lots of things go into this, but we have drier soils and vegetation now as a compared to the past, which gives kind of prime real estate for these wildfires to kind of spread. And then today, wildfires are larger and more costly to our economy. And all these future models suggest that they're probably going to get bigger and more frequent as well in the future. And then less snowpack and snowfall is contributing to this as well. And more precipitation over the years is falling as rain, and this further worsens the dry soil and vegetation that is fueling these wildfires. And this image I actually pulled relatively recently. This is taken from the 2024 Wapiti fire that's still burning in Stanley right now, and I think it's like 12 to 15% contained right now. And then it's hard not to mention wildfires without Alaska because they're a state that's been historically hit very hard by wildfires. And this information was pulled from the Alaska Center for Climate and Policy. So just to give some statistics to highlight this point, but from 2000 to 2020, there's been about 2.5 times more acres burned than in the previous 20 years, and 3 of the 4 highest acreage fires in history have occurred since 2000 in Alaska. And estimates by 2050 say that the burned area is projected to increase by somewhere between 24 to 169%, which is kind of a broad range, but this is broad because there's a lot of uncertainty with wildfires in general and about the predictions of how they're going to change in the future. But changes in climate will for sure cause longer wildfire seasons and increased fire frequency. We just don't know to what extent, kind of thing. And then not to hit too hard on Alaska, but I think it's just pretty, I mean, these numbers are pretty miraculous, but they hold the record for kind of largest wildfire in the Taylor Complex in 2004. They have the largest tundra wildfire and the Anuktivik River fire in 2007, and then also more recently the most expensive fire suppression in Swan Lake in 2019. And then these graphs I just showed to kind of give more of an idea of how much of a problem this is becoming over the last 20 or so years. But the graph in the top right shows the annual wildfire seasons for Alaska from 1950 to 2021 in terms of acreage burned. And then the red bars represent the years where greater than 1 million acres burned. And we can see that those years are not only becoming more frequent, but also more severe. And then the bottom one represents just shows the temperature changes in different regions of Alaska over the last 50 years, which you can see are pretty significant, especially up in that northern region. Next slide. And then this is another little study that I included that I thought was pretty pertinent, but this was one taken from New York that compares asthma ED visits to air pollution, which is pretty cool. But we can see more specifically that these figures show daily mean particulate matter and number of asthma-associated ED visits on both sides. So the blue line represents the amount of APMP, and then the blue bars overlaid on that represent the daily number of ED visits. And we can see the association between the peak of APMP levels and then asthma-associated ED visits as well. And that was kind of continuous across all regions of New York. And then if we go to the next slide. Kind of leaning more into the effects of wildfires and health. This is information from the Centers of Climate Change and Health, but clearly wildfires are a major source of this APMP, especially during the summertime in the West. And as we have seen, this increased APMP results in increased rates of lung cancer, COPD, asthma exacerbations, and even things like cardiovascular disease and premature death. And then wildfires also increase other harmful air exposures as well, other than APMP. And these are things like carbon monoxide, ground level ozone, toxic chemicals released from burning building materials, or even the chemicals that are used to actually fight the wildfires. And then, we think of outdoor air quality, but indoor air quality is also affected as smoke and APMP penetrate into buildings and homes, which we often forget about. But because people spend most of their time inside, especially when air quality is poor, the majority of exposure to and health effects from wildfire particulate matter come from particles inhaled indoors. And then, fire, of course, can cause immediate traumatic health effects with injury, smoke inhalation, and PTSD. And we just think of, the firefighters who are out there fighting this stuff can be pretty traumatic for them. And then interesting things that we figured about too, but we're seeing effects of that today in the Northwest, that wildfire smoke can travel super long distances and affect the health of people far downwind from the fire. So I just was in Salt Lake, and Salt Lake has a fair amount of smoke from the fires that are happening up here. And then if we think further back to a fire in 2004 in Alaska, it was one of the biggest fires recorded, as I mentioned in the past slides, and effects of that smoke were seen across the ocean in Europe, which is crazy. And then, this wildfire smoke and stuff just puts added stress on healthcare systems too, things like SNFs and things like that. And then if we go to the next slide, this is some data from the Center of Climate Change and Health. So this, tying these two topics together, climate change is going to significantly increase the frequency and severity of these fires, as I mentioned before, as well as the length of wildfire season, probably in the West. And there's kind of more and more development happening in what's called this wildland urban interface, which will just kind of compound the effects of these increasing wildfires. And then warmer weather and drought have led to a severe epidemic of bark beetles nationwide, which a lot of us may have heard about living in the Northwest. But since 2010, there's been about 66 million trees that have been killed by a combination of drought and bark beetle just in central and southern Sierras in the California region. But many of us have also driven through central Idaho here and Montana and forests and stuff like that and have seen the toll of beetle kill. And this is just, this gives off such a large tree die-off, which releases tons of CO2 and increases the risk of intense wildfires. And then, as I mentioned, climate change is worsening these wildfire rates and releasing large amount of carbon into the atmosphere and reducing the amount of forest available to sequester that carbon as well. And then the picture on the right is kind of just a heat map taken from the U.S. Global Change Research Project and depicts just kind of a projected increased percentage of large fires by 2050. And we can see kind of the region that we're all too familiar with is going to get hit pretty hard if projections continue. Next slide. And then sort of to try and leave on a positive note with wildfire mitigation or wildfires is talking about mitigation approaches for these wildfires. So what we can do as healthcare providers is just the biggest thing we would probably do is just advise patients, especially with pre-existing respiratory illness such as asthma and COPD, to be aware of air quality levels during wildfire season and to limit outdoor air exposure, but also be aware when they're indoors as well. Um, and then if they are indoors, advising them on simple things like keeping windows closed, setting their air conditioners to circulate rather than pulling air in from outside, and then uh, using things like HEPA filters to clean up the air. And then we can also discuss with patients about having an emergency response plan if they're at risk and create a defensible space clear of brush and trees to protect their homes if they're in a fire-prone area. And then also as healthcare providers, it's not only important to educate patients and coworkers about the relationship between wildfires, climate change, and our health, but also to be an advocate yourself for mitigation and adaptation strategies. And that can be things like land use policies, flame resistant materials, smart forestry management funding, things like that. We can go beyond our role in healthcare and kind of push for community changes as well. And this little kind of cartoon graphic I just threw in there too to kind of give you an idea of indoors is still better than outdoors, but there's still significant pollution indoors, and that these HEPA filters can drive that from kind of a moderate burden to a low burden if we advise our patients to use that. Next slide. And then, so shifting gears a little bit, that was kind of wildfires, but another big topic that comes up with respiratory disease and climate change is inhalers. And this is all over kind of the literature on this topic right now. But for years, we know that inhalers have been the mainstay of treatment for patients with obstructive lung diseases. And there are countless different types of inhalers out there, and they all have varying degrees of cost, but they also have varying degrees of carbon footprint. And so the big difference is the meter dose inhalers that we're familiar with are known to have much more of a carbon footprint than the dry powdered inhalers. And just roughly guessing this, its DPIs have an overall carbon footprint that is about 1/10 of an MDI for reference. Um, but this was shown to, I looked at a recent study in the British Medical Journal in 2022, which was through the Dutch health system. But this study, it was a descriptive analysis of prescription data pulled from national databases. And what it did is calculate the number of patients with COPD and asthma that were using inhalers, and they defined the number of doses of MDIs and DPIs, and then they estimated the potential emission reduction in CO2 if they were to get about 70% of MDI patients switched over to DPIs. And the study found that about 1.4 million patients met this criteria, so a pretty good chunk, and a total of 364 million daily doses of inhalers were dispensed, of which about half of those were MDIs. And then they didn't do this or implement this, but they projected that if this population using MDIs were reduced by 70%, it was estimated to lead to an annual reduction of about 63 million kilograms of CO2 equivalents emissions and 49.1 million euros per year in cost savings, which are both pretty significant numbers. Um, and just to give us an idea of what these kilograms of CO2 may look like in everyday life, the top figure kind of gives you an idea of that. But if we relate that to the study, about 1 ton of um, carbon dioxide equivalent emissions, or 1,000 kilograms, might look or would be about 63 million kilograms of CO2 equivalent emissions savings if we put that into the numbers from the study. And that would be almost 19 million reams of paper, or 380 million kilometers traveled by a car. I mean, just super high numbers. And then the bottom figure I included too, but is pulled from the 2021 IPCC report, and it depicts the relative global warming potentials of different greenhouse gases. So you can see carbon dioxide in the middle. And then a lot of these ones that are also out there are a lot more potent. So the one that I want to point out is the hydrofluorocarbons, and those are the things found in the MDIs, and they're extremely more potent than carbon dioxide. So even the small amount that we have in inhalers are having a huge impact on the climate. Okay, and then if we go to the next slide, this is kind of more kind of a medical update on what we can do with inhalers in general as healthcare providers and healthcare workers. But before even thinking about prescribing an inhaler, we have to make sure we have the right diagnosis, and we can do that by increasing diagnostic testing and accuracy. And then, just some statistics on this, about 44% of patients with COPD and, 33% of patients with asthma didn't even have the disease objectively through lung function testing, but were on inhalers and stuff already. And then we can also work on patients that do have the correct diagnosis and are on inhalers. We can work on adherence to guideline-directed care with controller inhalers and stuff, and that can decrease the use of rescue inhalers and things like that may not be necessary. And then it's always important, never forgetting to educate patients on inhaler technique as well, because that's something we forget. And if they're using it right, they probably have to use it a lot less, which can help the climate as well. And then when it's appropriate to prescribe an inhaler for either COPD or asthma, choose options that result in less overall carbon footprint. So if we get to that diagnosis correctly and we're treating them with the appropriate controller inhaler, pick one that is going to have less impact, and that's going to be a DPI over an MDI. When we are dealing with different inhalers too, it's also, we can also switch to different medication classes. So going from like a LAMA to a LABA with one that might have not as much carbon impact, and won't have as loss of efficacy for treating the disease as well. And then if we're using multiple classes, say an ICS and a LABA, it's cost saving and beneficial to the environment to use the combined inhalers when they're available. And then there's multiple types of MDIs as well, and there's some with less propellant too, which is better for the environment as well. And then I included this figure on the right. A lot of us are probably familiar, but it's kind of just the updated flow of GOLD criteria for COPD in terms of classification and stuff. I didn't want to get too far into it, but just kind of included that for your reference in terms of diagnostic stuff. And then if we go to the next slide, this kind of summarizes similar data or similar information to what I talked about in the last slide, but also gives us an idea of patient considerations to think about when prescribing inhalers. So just kind of takeaways to mention are that a new device can reduce patient medication confidence if it's a discus as opposed to an inhaler kind of thing. And then up to 68% of patients oftentimes are using their inhalers incorrectly, and they may be more prone to that if they switch devices too. So something to be aware of. And then it's also good to know that there's just some patients out there who just fail to generate sufficient energy to take that full breath kind of thing. And so those are our elderly patients, maybe our younger patients too. But really that takes up a pretty small percentage of total patients using inhalers. And then in regard to money, because this comes up pretty frequently, is DPIs tend to be equivalent in cost savings, if not cheaper sometimes compared to MDIs. However, I'll mention that this varies significantly depending on insurance coverage, unfortunately. But yeah, so multiple things to consider when you're prescribing these for patients or changing inhaler types. If we go to next slide. This is just something I put in before going into types of inhalers, but many of us who prescribe inhalers know that there's like so many types of inhalers and they come in lots of different names. So I just included this to know how to recognize MDIs and how to recognize DPIs. If it's a name that you don't see a lot and it sounds funky, it's probably a DPI because there's lots of different funky names for DPIs, and really MDIs only come in a few flavors, which is anything with HFA after it is going to be a DPI or a MDI. And then if it has Respimat or Ready inhaler, it's going to be an MDI. Otherwise, things like Advair discus, Lepta inhalers are pretty common. Respiclix are pretty common. Those are all DPIs, and those are the ones we want to pay attention to. And then if we go to the next slide, these are just some studies that I found that kind of provide evidence as to the support for DPIs over MDIs. So the first one was one in 2021 this looked at COPD patients with the purpose of showing non-inferiority between the two inhalers. And so this study took 342 patients, and they took COPD patients with an FEV1 in the 30 to 80% range, and they received 4 weeks of triple therapy inhaler treatment with either MDI or DPI, had a 2-week washout, and then switch inhaler type. And this was a double-blinded randomized study. and the results showed no significant difference or non-inferiority between the MDI and DPI, which is great. And then I found one for asthma too in 2020, not as long or as big of a study, but it was a RCT involving 63 asthmatic patients with the goal of showing non-inferiority too. And these patients were diagnosed with moderate to severe asthma, and they were treated with either a fluticasone formoterol, MDI, or DPI. And unfortunately, this study was not blinded, but the results were also non-inferior between the two groups. And then in 2021, there was a study that, and this one's good because it looks at the emissions impact of the inhaler as well. And it was from 2021, and it was a post hoc analysis of much more patients, about 2,200 asthma patients on MDI controller inhaler, and half of them were randomly switched to a DPI formulation of the same molecule, so an ICS LAVA inhaler. And they found that the annual kilograms of CO2 equivalents for the DPI group was about 108, and it was like 240 for the MDI group. So a more than 50% decrease in carbon emissions switching to the DPI. And then additionally, on top of that, the DPI group also showed greater control in their asthma. So it was like two-pronged reason for switching, which is a great result for this study. And shows that, multiple reasons to switch to these DPIs. And then this I wanted to include with a bunch of animations in there. Sorry, Layla, but if you want to click through some of these as I walk through. But this is a inhaler chart that we've all probably seen if we go through clinic. But for each of these classes, I just put circles over the DPI options because essentially all of these have DPI. So if you scroll through with the SABAs, we can see a couple. And then the next one, Layla, are the LABAs, and then the ICS category has a whole bunch of options, and then the LAMAs have options. And then the combined, as we get down there into green, have options too, green or brown. I'm not sure what that color is. And then there's a couple more in there, Layla, too, for animations. But I just wanted to show this kind of graphically because it gives me a pretty good visualization of just how many DPI options there are out there. And if patients are on, albuterol HFA or something, that there's an equivalent molecule in a DPI formulation that's a lot better for the environment, and it's not going to take a toll on the efficacy of their asthma or COPD treatment, which is great. And this, of course, I'll mention this with the caveat of insurances that some cover HFAs over DPIs, and we have to go through hoops for that. And I'm aware of that. And then I'll also mention too that Symbicort is something that we prescribe a whole bunch, and I have patients on it. And there's a Symbicort HFA inhaler, and there's a Symbicort DPI too. I think it's called like the Symbicort Tubi inhaler or something like that. But there's a letter out to AstraZeneca right now to hopefully get that available in the US because it's not available right now. And it's something I encourage all people working in healthcare to take a look at and sign if they're passionate about that. I, again, don't have any relationship or anything with AstraZeneca, but just am passionate about getting these DPI inhalers available for us. Next slide. I think I just have a couple more slides to go through here for us. And there's kind of closing tips for us is that, walking through these slides, I think it's pretty apparent that the climate crisis is also a health crisis. And this came up in the most recent COP20. I think there may have been one after this, but COP26 in Glasgow in 2021 was a meeting of the UN Climate Change Conference. And this was the first one where the health agenda was part of the meeting. And they identified healthcare professionals and patients as activists in this health crisis. And they brought up some adaptation strategies that we can work on, things like providing advice to patients to protect themselves during heat waves, education on changing allergen seasons and wildfire episodes, and then just encouraging more time in nature or prescribing nature, which I thought was cool. And then, mentioning things like planetary health, bringing this up in conversation is great to do. And in simple terms, it's just the interlinkage between human-induced deleterious changes in the environment and its impact on human health. And then we can support and kind of encourage these idea of co-benefits more, which is mitigation activities that can help advance climate policy while also improving individual health. So these are what we kind of want to focus on. And examples of these co-benefits are things like reducing air pollution, carbon emissions, increasing exposure to nature and green spaces, as I alluded to earlier, and then simple things like promoting active travel, physical activities, and sustainable diets. And then next slide, Layla. And then this is just kind of the last slide of kind of tips and takeaways for how to be a sustainable physician, but this can apply to anyone really working in a healthcare facility for a lot of these. And it's just acknowledging and discussing climate change and the effects on respiratory health with patient and colleagues, improving and providing continued education for respiratory healthcare professionals on the impact of climate change, focusing our attention on high risk and vulnerable populations, as I alluded to, including elderly folks, children, pregnant patients, socioeconomically disadvantaged groups, things like that. And then using this nature prescribing more. This is definitely something I want to do, is to just improve physical and mental health of patients with respiratory diseases and to mitigate the effects of climate change. But also being aware of air quality and aeroallergen exposure, so doing it at the right time. And then maybe establishing environmental monitoring for new allergenic species as potential triggers for allergic respiratory conditions. And then advocating for the provision of cooling places. This is super important to do over the hot summer months and to make these available to individuals with respiratory conditions at high risk during these heat waves. And then always promoting climate-friendly activities and lifestyles among both clinicians and patients that will lead to personal health and planetary co-benefits, which is what we're looking for. And then I think also we can use our role as healthcare professionals and trusted members of the communities to raise awareness of the impacts of climate change and just to boost national or even international policy action. And then, conducting interdisciplinary research is always important to kind of advance our knowledge on these climate change impacts and how we can implement kind of adaptive mechanisms to fighting this. And then probably the biggest one is just act as an example in reducing greenhouse gas emissions ourselves. And if we act as a good examples, I think that carries over to patients and people we see in the work that we do. And then next slide, I just, for fun, kind of threw in, this is very simple DIY HEPA filter make that you can give to your patients or just talk them through. They're very cheap and affordable to make during these times when we're dealing with a bunch of smoke. I think that's all I have. Sorry, I did not leave a ton of time for questions, but we may have like 2 or 3 minutes if anyone has anything burning.
Okay, well, thank you so much for that presentation. I appreciate your time. I appreciate everyone being here. And our next session will be October 9th, and we hope to see you then. Everybody have a wonderful day.